Today I'd like to speak about some of the disparities in healthcare. One of the topics that gets a lot of attention currently is the topic of what we call systemic racism. A lot of times the term is used and it becomes kind of a turn-off term for people because they're like, there is no systemic racism. There might be individual instances of racism. There might be some people that still are racist. But really, we as a country have moved away from racism in our official policies. So what does this term mean, systemic racism? A lot of times people just rebel against it, say it's nonsense, it's crazy, people are talking too much about racism, I don't want to hear about it. But really, I think what it comes down to is looking at equities. And equities really are the basis for justice. If one group is not being treated in a fair way, then you have a concern. And you have to ask yourself, well, why is this so? So first, you have to establish, what is the issue? Uh, in what way are they not being treated equitably? And then if you can discern that and see that there is an inequity, then you can say, well, what are the causes of it? How can it be remedied? We can enter into a dialogue about possible solutions, possible way forward. And again, this is not certainly an easy thing to discern. It takes study, it takes a critical review, and then there can be a way forward. To help in that discussion, I recently came about some information about disparities in healthcare. So healthcare is one of those issues where people sometimes talk about systemic racism or inequities, great disparities. And when you look at healthcare, you want to look at different groupings. So you want to look at white, black, Asian, Hispanic. Those are generally the four categories that you investigate and look at and try to discern what's happening to each of those groups within the general concept of healthcare. One thing that has come out recently is a report from a group called the Commonwealth Fund. It's a Manhattan-based healthcare nonprofit. And what they tried to do was to study different groups, black, white, Asian, Hispanic, and look at health outcomes to kind of get into a discussion about really, are there disparities? Is there something systemic? Is there something we can address? And I'd just like to share some of the results of this study. And again, it's something that we can look at and say, well, did the study get it wrong? Should we do other studies? And there are other studies that have been done that have different conclusions. So again, just one study, but a study that might be helpful, it might be fruitful, it might lead to further investigation, further understanding. One thing that was interesting in the study was with regard to black New Yorkers. It was a study within New York. And they said black New Yorkers receive better health care and have better health outcomes than their counterparts in other states. So again, a positive statement. Those who are black, better health outcomes, better health care than blacks in other states. Certainly something that New York can say, well, that's great. We're doing something better than other states. However, on the other side of that, they still have higher rates of infant mortality, preventable deaths, and difficulty accessing care than white residents. So here in New York, although black residents have it better than in other states, still, if the comparison is with those who are white, there is a disparity, there is an inequity, there is something that we should discern, look at, and say, can we do this better? Is there a solution? Can we level the playing field so there is not this disparity? Latino New Yorkers have lower rates of preventable deaths and of some diseases than whites. So again, another interesting fact. Those with a Latino background seem to do better in terms of preventable deaths and of certain diseases than whites. So you might say, well, the whites doing better than blacks, in some areas Latinos doing better than whites. So again, another area where can we level a playing field. Uh, Yet Latinos are more likely to be uninsured than whites, Asians, and blacks. So again, you look at this and say, well, this is an interesting finding. Latinos have lower rates of preventable deaths and of some diseases than whites, but on the other side, they are more likely to be uninsured. So what does that say about the relationship between insurance and healthcare even? It raises certain concerns. They're not, insured. They get their health care in other ways. That would be an interesting thing to explore, certainly. Also, Latinos are more likely to go without care because of the cost. So again, there's an issue sometimes of cost. Will people access the care? You would hope that they would, so that they can get proper treatment, but it seems that Latinos are more likely to not get the care because they're concerned about the cost, the affordability, they can't pay it, so they don't get the care they need. So this study by the Commonwealth Fund examined healthcare outcomes. It examined access and quality of care. And they came up with, in those three categories, scores. And the score they gave was 90 to whites, 75 to Asians and Pacific Islanders, 56 to Latinos, and 53 to blacks. So you can see by the scoring system, blacks were way underneath by 37 points, and whites, Asians a little bit closer, Latinos kind of very close to blacks. New York was one of 5 states where blacks and Latinos had better overall health care than the national average for all Americans. So again, even though lower than whites, lower than Asians, certainly better than in other states, which is a positive when you look at the study. It found that there was greater access to health care in New York. So New York has taken a role to make sure that those who are New Yorkers have greater access to health care. Also, the percentage of uninsured residents is lower in New York. So that could be a factor where more residents have insurance. And the medical coverage in New York is more expansive. So more people are covered in New York. Other factors might be New York has higher than average income and also higher than average educational levels. So the greater income, the greater education in New York might be a factor. And in subsequent parts of this series, we will look certainly at some of the other factors and considerations that came out from this study of the Commonwealth Fund and ask ourselves this question: what are the disparities? Do the disparities show something systemic? Can those disparities be addressed? Can we make healthcare more equitable for all and make this much more of a level playing field?